On to learning unit number 2. In this learning unit, we're going to focus on the anatomy and physiology of emotions. This includes how the body responds to emotional threats and how the body reacts to these threats as if they were a physical threat, eliciting the fight or flight response. So we're going to be able to recognize the meanings of different emotions and the ability to reason and problem solve on the basis of them. That's the definition of emotional intelligence. We're going to finish this learning unit by looking at the literature and seeing how the literature does demonstrate a correlation between leader effectiveness, wellness, and career longevity with emotional intelligence. So again, the leader's effectiveness, wellness, and career longevity is correlated with their emotional intelligence. So by the end of this unit, you're going to be able to discover the structure and function of emotions. We're building further on our ability to identify emotions that we really were pretty thorough with, I believe, in our resiliency course, and the way emotions relate to human physiology. We're going to be able to identify emotions in ourselves as well as others, and that's critical. And I think it's a skill that even though we went over in resiliency course, we really need to solidify and practice that identification of emotions in ourselves so that we can identify them quicker and make changes sooner in when we see those in others. And we're going to look at the application of emotional intelligence to conflict resolution, essential for nurse leaders, consensus building and team building, also essential, and working with change resistance. And then we're going to talk about the ways in which EI leaders that have high emotional intelligence, have been shown to be more effective. So you're going to read chapters 2 and 11 in your nursing text. You're watching this video. You're going to review a periodic table of emotions. There's going to be 2 care sheets, the evidence-based care sheets. One is EI in nursing practice. The other is leadership and emotional intelligence. The one I put down is optional. I'm trying to keep the load, the reading and the learning assignments lower for these learning units, because I do know that you're continuing to work on your practicum modules and your clinical hours. Read Rose Sherman's Fostering EI with Your Team. Listen to an Add Heart call and complete your discussion board post. There are no replies required this week. Most of the weeks I'm going to stop with some of the replies unless I think they're really super beneficial. But I do ask that you still post by Thursday. So even if you're not replying, I know that we do enjoy and learn from one another. So please do read some of your classmates. That's why I'm still asking for Thursday. So moving on, a concept that I wanted you to keep in mind is bounded rationality. Now, we talked about bounded rationality in our health policy book. And so I cite one of the quotes from Short, and that is bounded rationality is the reality. So we're looking at the reality, right? That rationality is limited, that humans make decisions influenced by emotions, fatigue, and a constant lack of full information. No matter how evidence-based practice focused we are, we always in healthcare realize that we're working with a lack of full information, both research and just the quickness of decision making that's required of nurses and nurse leaders. And that time is always limited. Nothing new here, right? You can probably say, yep, I know that decision making is influenced by emotions, fatigue, lack of all the information, and limited time. But in short, this is according to the quote, in short, decision makers are goal-oriented and adaptive. But because of this cognitive and emotional architecture of human beings, they sometimes fail. Occasionally, they fail in important decisions. So this is the concept of bounded rationality. And I think it also allows us to be more compassionate to ourselves when we do fail, even though we've given it our best. When we fail, when we're questioning whether we've given it our best, and when others, don't always make the best decisions. It's one of my favorite concepts to really chew on because it is based in reality. So chapters 2 and 11. My other favorite is the periodic table of human emotions. And I'm going to get back to that in just a minute. Fostering emotional intelligence with your team is very short. It comes from Rose Sherman from her blog. And she talks about, we've spent the first week and some of this week looking at emotional intelligence and how to build our own. But this is fostering emotional intelligence with your team. A quote from this blog is, emotional intelligence is a collective responsibility and requires team members to prioritize the group's emotions and social interactions. Teams with high emotional intelligence think about the impact their behaviors and actions will have on the group. So as a leader, we need to help not only ourselves build emotional intelligence, but our teams. Great little article. Then here is one of the leadership and evidence-based, or leadership and emotional intelligence evidence-based care sheet. You're going to need to review that for your discussion board. Optional if you want to look at another quick evidence-based care sheet. This is EI in nursing practice. This is the Add Heart call. It's 30 minutes. Heart Math Institute. Remember when we worked on our heart rate variability biofeedback, what I referred to earlier in the resiliency course, we really developed more a self-awareness of emotions. And so I want you to come back to asking yourself as you go through the day, what emotions am I currently experiencing? And then remember this practice that Heart Math Institute offered us. Be aware of our feelings, acknowledge our feelings, pause, breathe in feeling inner ease, draw in feelings of patience, and calm for 30 seconds. This anchors in this heart's intelligent. So, and heart's intelligent. Intelligence, right? So anyways, you can read that better than I can say it today. So it's a good audio recording. I think you'll enjoy it and remind us of a practice that we started and had developed. And I hope some of you are continuing with your heart rate variability biofeedback. So your discussion board, remember, no replies this week, but do post by Thursday evening, is in Chapter 11. We saw how EI abilities can be used by nurse leaders to manage change resistance, groups consensus, and conflict management. We also read about the anatomy and physiology. For this discussion board, I want you to elaborate on how you, as a nurse leader, will develop your emotional intelligence abilities in order to develop your expertise in one of the following: either change resistance, group consensus, or conflict management. Are you a leader that has a team and there's a lot of conflict management? Do you want to decrease change resistance in your group? Do you want to build consensus? Whichever one, focus on how you're going to develop your emotional intelligence, your expertise. Please use what we know so use one of your evidence-based care sheets, the HeartMath audio, and the information from Rose Sherman on fostering EI in our teams to support your post. I want to see those cited and that you've thoroughly reviewed that. So let's just, before we end, let's get back to the periodic table for human emotions. I came across this a few years back. I absolutely love this table. I have it framed in my office. So what I like about it is that it gives you the basic emotions of love, joy, surprise, anger, sadness, fear, and disgust. Typically, we're pretty good at identifying these basic emotions, but sometimes we even need work on that. And then it gives you emotions within it. So for love, it can be empathy, serenity, tenderness, sympathy, compassion. I'll let you read through. Anger, of course, is red. And you might not be able to read this one, but incomprehension. I can't believe that. You know, how many times we've said, I can't believe that. And they list that as anger. I guess if it was a more positive, like, oh, I just can't believe the beauty of that, that would be surprise, perhaps even going into love. But it's a great, it's just a great little periodic table of human emotions. I believe essential for us to identify in ourselves so we can identify in others. Have a great week.